Hello, my name is Rachel Kelly, and my discussion post topic for this week is thrombocytopenia. Thrombocytopenia is when you have a low platelet count. The word actually directly translates to too little platelet count. The word penia indicates that there's a deficit or that we're missing the amount that we need, lacking, and platelet is actually synonymous with thrombocytes. So generally, a low platelet count is a secondary problem. So this condition is caused by potentially cancer or another autoimmune disease or potentially alcoholism. And because of that, it causes the body to destroy or use the platelets quicker than the bone marrow can create. The spleen is often a factor in this. Thrombocytopenia is an idiopathic condition. So for each person, although the condition they all may be experiencing low platelets, the cause for their condition varies. It may have a genetic factor as well. As a nurse, there are assessment factors that you can observe. You're going to see potentially bruising, easily bloody gums, petechiae or purpura, so capillaries are bursting in their skin. You're seeing purplish marks or potentially just dots. You could see abnormal bleeding, epistaxis. Low platelet count on the CBC is going to be a diagnostic factor as well as a part of the assessment. They could have a non-palpable spleen if the spleen is involved, and you're also going to be observing for hemorrhage or spontaneous bleed. In addition to that, vital signs that correspond with those situations, if the person is experiencing infection, you may see an increase in temp. If the person's experiencing a bleed, you could see symptoms of hypovolemia or low blood pressure, hypotension, all indicative of the bleed. For nurses, you're going to have three major diagnoses. There's going to be risk for bleeding related to decreased platelet count, risk for injury related to abnormal blood profile, and risk for infection related to the suppression of the immune system by steroids. That one may not be seen in all patients, the last one, but for patients experiencing steroid therapy or an infection related to thrombocytopenia, this will be a factor. Or if the patient, yes, that's actually all. So for thrombocytopenia planning, you're going to make sure that the patient and the caregivers are ready to take the measures to prevent bleeding and recognize the signs of it and report to their HCP. You want to make sure your patients do not experience any bleeding, and this will be indicative by labs, vitals, as I said before, vitals, but labs as well. You'll see changes in the H&H if the person is experiencing a bleed. You're going to look out for that, and you want your PT and INR levels to be in the normal range, so less than 2. Patient remains free of injuries because they are at risk for a bleed. They want to still be able to do their ADLs, so you don't want to inhibit their ability to take care of themselves, but we also want to make sure that they are free of infection. And we're going to have frequent vital signs so we can monitor the development of an infection. So the implementations for these goals include continually assessing for internal or external bleeding. This could be melena or just bleeding from the gums. I don't mean to make that sound less serious than it is, but any bleeding while you're experiencing this is a big deal. Medications will be administered, and they may also have platelet or blood transfusions as indicated. So a low platelet level count does not necessarily mean that you have to administer platelets, but it's going to be dependent on whether or not the patient has an active bleed. And the different drugs that you would administer are also going to be based on the particular patient. There are certain drugs that only males are indicated for males, and there's also a first and secondary line of response for this case. So you're going to have the immunosuppressants, and you may have steroids, and also as a third defensive inca, alkaloids are indicated. And then antibiotics if your patient does indeed have an infection. You're going to avoid NSAIDs or anything else that affects platelet levels, so alcohol as well. And that's going to also be a part of your nutrition and lifestyle education. That's going to be a major implementation for people with this condition, because in addition to avoiding the NSAIDs, they're also going to make sure that they are prepared to take care of themselves in terms of their risk for bleed. So avoiding potentially injurious activities or any risky behavior. Bleeding precautions that could be fall precautions as well if your patient is is at a certain level of mobility, but that's going to be dependent on the patient as well. But stool softeners are another medication that could be indicated just if your patient is experiencing a melena. You don't want to be putting any more strain and causing any further bleeding, tearing in that patient. So you're going to continually review and trend your labs. This includes platelet count. You're going to do an H&H as well, and then you're also going to be doing your clotting factors. For prevention of injury, place a call it within reach for the hospitalized patient and teach them how to call for assistance. Don't keep them waiting. And in terms of the spread of infection, you're going to be doing hand hygiene and making sure your patient is educated in hygienic practices, another major factor of the education aspects of this condition. And for patients with this condition, you're going to recommend 2 to 3 milliliters of water unless there's a contraindication like chronic kidney disease or something of that nature. So then you're going to evaluate your care plan and how effective it was. So the patient and caregivers took measures to prevent the bleed, and the patient's blood pressure remained normal, stable hemat H&H, normal coag profile in the desired range rather. Patient is free from injury, able to participate in ADLs, not experiencing infection, and early recognition of an infection will be treated promptly. And all of these evaluations, when they were done for the care plan and that specific patient, would have a specific time goal. For instance, the patient remained free from injuries throughout their hospital stay. But once again, that'll be indicated based on your specific patient for this idiopathic condition. Thank you for your time, and that is all.